I living with HIV. I'm positive. The treatment is not good. The people here are dying.
It's not a death sentence anymore. And if treatment is started early enough, people can live, at least medically, a quite normal life.
I came to try and tell the truth about corruption in the Ministry of Health officials in Tansania.
Höhere Preise dienen eigentlich nur dem reinen Profit eben der Firmen, die damit handeln.
We are coming to say we need machine to testing our CD4.
Right Here, Right Now is the central theme of the 18th International AIDS Conference taking place in July 2010 in Vienna, Austria. Hundreds of international organizations, companies, scientists and activist groups are expected to attend the conference from all over the world, making Vienna the center of the global combat against HIV and AIDS. Right Here, Right Now, an ambitious goal that Aizack Sanga, a 53-year-old HIV patient from Tanzania, can only dream of.
My name is Aizack Sanga. I'm from in Tanzania, in Makete. I living with HIV. I'm positive.
According to 2008 estimates, approximately 1.3 million Tanzanians are HIV positive. Aizack, a member of the HIV self-help group Piuma, traveled 8,000 kilometers from the tiny village of Bulongwa in Makete district to deliver an important message.
We are coming to say we need machine to testing our CD4. Because even our children, we need people we can test because we don't have a machine to test our children.
Aizack is talking about CD4 counters, medical testing equipment to measure the so-called CD4 count, which indicates the amount of T helper cells in the human body. CD4 counters provide valuable information about the immune system and the treatment of HIV.
After an infection with the HIV virus, the virus will enter the so-called CD4 cells or helper cells. These are lymphocytes that are needed to protect the body from several agents that can cause disease. The CD4 count will go down steadily. It might take a year or it might take 10 years, but eventually the immune system will be so weak that the body will be harmed by pneumonia, tuberculosis, diarrheal diseases. So there are many infections and also malignancies, cancers, that can easily establish a disease if the immune system is down.
In order to detect dropping CD4 counts as soon as possible and to start treatment in time, the World Health Organization, WHO, recommends periodical CD4 tests. In industrialized countries, CD4 tests are usually done every 3 months.
The antiretroviral therapy is a combination treatment. So most of the times we use 3 different drugs that are all effective against HIV. And what they can do is they can avoid the replication, the multiplying of new virus.
A normal CD4 count in a HIV-negative adult can vary, but is usually between 600 and 1,200 CD4 cells per microliter of blood.
There are plenty of studies showing that with antiretroviral treatment, the life span can be prolonged. What should be spread is the message that it's not a death sentence anymore, and if treatment is started early enough, people can live, at least medically, a quite normal life.
Periodical CD4 tests are also recommended to monitor the effectiveness of antiretroviral therapy. A dropping CD4 count could either suggest that patients are not taking the medication properly or indicate the development of resistance to the current combination drug, which calls for the need to switch to another medication.
I take medicine without to testing our CD4. Even my card, I can show you if you want to see.
Of course, just show me your card.
Okay.
Show me the last entry. When was it, the CD4 count done the last time?
The last
It
was here only.
On 29th of July in 2005.
Yes.
Okay. Okay.
Then
So
from that day up to now, I getting on medicine without to know our testing. I went myself about 5 times. He get my blood, but without to give me result. I asked them. He said the machine is spoiled.
Until April 2006, the HIV patients of Bulongwal Lutheran Hospital were tested on a regular basis and treated accordingly. Suddenly, the CD4 counter at the hospital was replaced by a different type of counter.
The first one was a nice one who myself am tested up to now. I'm not dying. Many people, member of Puma, was testing for last machine. Not machine is using now this time is spoiled, it is not working.
Why should a working CD4 counter be replaced by another instrument which has reportedly never worked properly?
I came to try and tell the truth about corruption in the Ministry of Health officials in Tanzania, which was muffled up in a report which I wrote and which was just thrown away in the dustbin.
The chemist Juma Madati was a member of a ministerial probe team created by the Tanzanian Minister of Health to investigate sabotaging and bribery allegations raised by the Tanzanian media in regard to the evaluation of a system called Cyflow, a CD4 counter made by the German company Patec. Based on an evaluation conducted in 2005 by Muhimbili University College of Health Sciences in Dar es Salaam, Tanzania, the ministry decided not to procure the instrument.
The ministry thought that it was unsuitable. What happened was, after disqualifying the Cyflow CD4 counters, the ministry officials banned all Cyflow machines, including those models which were not evaluated at all by the referral hospital at the university. And not only that, but they went on, the ministry ordered the replacement of all the banned Cyflows by a CD4 counter from America, which is called fax count.
Is it really true that the Cyflow is unsuitable for developing countries like Tanzania?
The Cyflow was evaluated all over the world. Many papers, more than 30 of them, have been published. People from Harvard University, you have people from Senegal who evaluated, telling that the Cyflow is very good and sometimes better than the reference methods.
With the Cyflow machine, we got very good results in Malawi. We made some tests also, of course, to evaluate the results and the accuracy of the results were very good.
Evaluations from all over the world attest that the SciFlow is accurate and performs well. So why was the instrument banned in Tanzania?
Obviously, this is why we thought that there is some signs of corruption, because the ministry officials, including the referral hospital which investigated it, which evaluated the SciFlow, found out that the instrument was not functioning properly at a certain level of CD4 count.
After investigating the sabotaging allegations, Juma Madati came to the following conclusion.
The ministry authorities deliberately kept the instrument, the SciFlow instrument, plus its reagents for over 10 months, which is way beyond the shelf life of 6 months of these instruments, which means the reagents were not able to tell the truth or even function at all. The reagents are supposed to be kept between 2 and 8 degrees centigrade. In Tanzania, the temperature was about 25 to 30 degrees. They were overheated, so they were in no condition to be used for evaluation at all.
MSF, Doctors Without Borders, is also satisfied with the performance of the SciFlow.
It's a tool that needs some skills and some technical knowledge. It's not perfect in terms of simplification. We need more simplified tools, but at the moment it's something that is very helpful for our projects with MSF, and we are happy that we have those machines available.
SciFlows have been used all over the world, and everybody never suspected the SciFlows of inability to determine CD4 counts at any level.
The US company Becton Dickinson, based in Franklin Lakes, New Jersey, has about 29,000 employees in 50 countries. In 2009, BD had revenues of more than $7 billion. The fax count manufactured by Becton Dickinson was the first CD4 counter to ever be produced and did not have competition on the African market throughout the 1990s. Now, other companies like Partec have caught up and gained market shares. Partec, based in Görlitz, Germany, has about 140 employees in 17 countries and revenues of $37 million in 2009. Partec's SciFlow was brought onto the world market in 2002 and is now being used in more than 100 countries. While the SciFlow is being offered globally for in vitro diagnostics, the fax count is only being used for research in the European Union and other countries.
A CD4 counter should be very simple to use, should require a minimum of maintenance or sophisticated equipment, or maybe even work without electricity, should be very easy to be used by non-professionals, which means non-physicians or non-lab technicians, and should be cheap and should just be feasible to be used in the field.
Die Firma Partec arbeitet jetzt seit circa 8 Jahren in diesem Feld und es war eine Grundsatzentscheidung am Anfang dieser Entwicklungen, dass wir einen kostengünstigen Test anbieten, der wirklich eben auch von den Stellen in den Entwicklungsländern und dort, wo es gebraucht wird, bezahlt werden kann. Er wurde also am Anfang auf 1,75 € pro CD4-Test festgesetzt und das stand im sehr starken Gegensatz zu den Testpreisen, die in den Ländern damals vorherrschten. Es wurden also, da eine gewisse Art von Monopol bestand, Testpreise bis zu $160 pro CD4-Test verlangt. Und das war natürlich ein Grund dafür, dass nicht sehr viele Patienten untersucht und behandelt werden konnten.
The fax counts had type of reagents which are far more expensive than Cyflow, and in fact a lot of countries when they replaced all those Cyflows with fax counts in Tanzania, most of those fax counts, over 50% of them, lay useless because people who owned them could not afford the expensive reagents.
In my country, the CD4 tests were around $50 to $100 each test.
Es besteht keine Notwendigkeit, diesen Test eben mit Antikörpern eben zu hohen Preisen anzubieten. Es ist nicht gerechtfertigt, da der Einsatz der Antikörper, also der Chemikalien in diesen Röhrchen eigentlich nur Centbeträge ausmachen, und damit ist ein Testpreis von zum Beispiel bei uns von 1,75 € für den Test gerechtfertigt. Höhere Preise dienen eigentlich nur dem reinen Profit eben der Firmen, die damit handeln.
Not only the cheaper reagents required to run the machines make the German-made Cyflow more suitable for resource-limited settings such as Tansania, but also its greater usability.
And that meant also that a lot of those instruments lay unused because there was no technician who is specialized enough to operate them. Whereas the Cyflows were so easy to operate, even the ordinary type of technician was able to operate them.
When working for MSF Doctors Without Borders, Florian Breitenegger could compare both instruments.
MSF is using both systems, but mainly the Patek Cyflow because of several advantages. The Cyflow is cheaper to use. It can run more samples per day. It's easier to maintain and to run the machine.
Apart from the total CD4 count, Cyflow can also determine the CD4 percentage, a value indicating the proportion of CD4 cells compared to all other types of lymphocytes, which is important for the monitoring and treatment of infected children.
From 0 to 6, you need CD4 percentage because the immune system is not yet well developed, it's not mature.
The percentage is a stable value, so it's more easy to interpret a result than when you have only the absolute count, because then a child, let's say of 1 year, with a CD4 count of 500, which would be normal for an adult, is a low CD4 count for a child.
And so it meant that a lot of children died before they started any treatment simply because they didn't have an instrument to make them eligible to get ARTs, antiretroviral treatment.
Why should a poor country like Tanzania purchase the fax count manufactured by Becton Dickinson and ban a cheaper and more suitable instrument?
It doesn't enter into anybody's right mind why somebody can bring in an unsuitable instrument which cannot even help the children and leave an instrument which is suitable. The only reason could possibly be corruption, that somebody, the manufacturer of this new instrument, may have been bribing somebody in the whole system of procurement, and they are able to procure something which is not suitable.
In his investigation report, Juma Madati states, right from the word go, people who were entrusted to expeditiously evaluate the Cyflow had their minds set to disqualify the Cyflow machine one way or another.
These officials without mentioning names, it's not necessary, but they are the most senior officials of the Ministry of Health. And they did it through a board which supervises all devices, medical devices and reagents which are used in human beings, including these CD4 counters and their reagents.
Surprisingly, the decision of the Tanzanian Ministry of Health to not purchase Cyflows was also backed up by WHO EHT, the Essential Health Technologies Department of the World Health Organization in Geneva, Switzerland.
It appears that one of the senior officials of Ministry of Health leaked the information to, it was the first to leak the information to WHO, EHTL, that the Cyflows were unable to detect properly CD4 counts below 200. And a senior official of WHO took that up and supported the Ministry of Health decision to disqualify Cyflows and ban them completely and replace them with fax counts.
In a confidential email dated from the 23rd of December 2005, Dr. Gabi Verkauteren, a health technologies expert of WHO EHT, wrote to Dr. Faustine Dugulile, the by then head of the diagnostic section of the Tanzanian Ministry of Health. When asked for advice on the Cyflow instrument, I have always mentioned that data are conflicting, and as the company has not been willing to participate in an independent WHO validation, we are not in a position to buy their equipment. Partec contests these allegations, referring to numerous international studies attesting the Cyflow as being highly accurate. The company also affirms that they have repeatedly invited WHO EHT to attend performance demonstrations of the Cyflow. Our research further revealed that WHO has been purchasing Cyflows for years, like other international organizations, including UNAIDS, UNICEF or MSF. Juma Madati concludes: there appears to have existed a conspiracy which aimed at making health authorities and the public in Tanzania believe that fax machines are most superior and more ideal than any other CD4 counting machine for the developing world. And if this conspiracy succeeds, it would preserve the status quo, whereby CD4 cells counting machines manufactured by BD would remain predominant. Juma Madati's report was never officially published by the Tanzanian Ministry of Health. Where else should open questions concerning HIV and AIDS be answered if not at the world's largest AIDS conference? At the conference, we requested interviews with Becton Dickinson, the Essential Health Technologies Department of WHO, and with Dr. Faustine Dugulile. We only received a reply from Dr. Gabi Verkauteren of WHO EHT agreeing to give us an interview. The day before her interview, she suddenly declined to take part without giving us an explanation. Since we didn't want to give up that quickly, we decided to try our luck at the information booths of Becton Dickinson and WHO at the conference venue.
Are you working for BD? Yes. Well, we are doing a documentary on CD4 cell enumeration technologies. And I don't know, do you like to introduce us to your products?
Actually, there's a person that we have available that handles the media. So let me give her a call and then she'll come over and you can talk with her.
I understand. Well, actually, we just want to know about something about your products. And
she'll be able to, I think, provide whatever information and answers you need for your interview.
Okay, so you don't want to give us information, or you are not allowed?
No, we want to. Like I said, I just want to get the media person over to talk to you guys.
Okay. Thank you. Thanks. Hello? Yeah, here's Fabian Dirnsberger speaking. We would like to conduct an interview concerning CD4 testing in Tanzania.
After an hour, Alyssa Seth, the media person of BD, called us back.
So is it possible to talk to you? There is no one coming to Vienna. Okay, there are just the people at your booth. Well, we would really appreciate to talk to somebody of you, if possible. You cannot give us an interview, is that right? What's the reason for not giving us an interview? I mean, I'm sure somebody has to be here from BD. So which situation are you talking about? I mean, I just want to talk about CD4 cell enumeration in Tanzania. So it's nothing bad, I guess. So I just wonder why no one can talk to us. The problem is, you know, this man, this HIV positive man came all the way up here to Vienna to talk to you because, you know, there is a specific problem at Bologna Lutheran Hospital. There is no CD4 percentage and children cannot be tested. So we would like to know what you can do to provide CD4 percentage testing to the people of Bologna. And also, the fax count at Bologna Lutheran Hospital is reportedly not working most of the time. So we would like that these problems get fixed. And she said, well, the specific situation I'm talking about concerning Tanzania cannot be answered by anyone here at the conference.
Our questions concerning the specific situation in Tanzania could also not be answered by the WHO, which we contacted 3 times during the conference.
Hello? Hello, can you hear me? I just talked to Ms. Tonga from the WHO. I asked her, I already talked to her before, maybe 1.5 hours ago. And she told me that Dr. Verkauf, unfortunately, did not show up in Vienna, although she was supposed to come to the conference, but she obviously postponed or cancelled her trip to Vienna.
We never received a reply to our email requesting Dr. Verkauf's phone number. Later on, we had learned from staff members of UNICEF, another sub-organization of the United Nations, that Dr. Verkauf was in fact present at the conference. We repeatedly requested an interview with WHO EHT and Dr. Faustine Dugulile after the conference. While Dr. Dugulile never responded, WHO EHT replied after several inquiries stating that an internal investigation conducted in 2008 did not establish any evidence supporting a prima facie case of favoritism, bias or prejudice on the part of Dr. Verkauf and was unable to identify any improper behavior by WHO staff in the context of the evaluation of the Tanzanian Ministry of Health's evaluation of the performance of the Partex Cy-Flow product. Yet, WHO decided not to disclose the findings of the internal investigation publicly and ignored several requests to provide us with the investigation report. Unlike global players like Becton Dickinson and WHO EHT, the company Partex seemed to be much more cooperative. Under supervision of a medical doctor specialized in HIV, the company agreed to measure Aizack's CD4 count. Although he didn't receive any answers to his questions, the Tanzanian HIV patient finally gets tested again after waiting more than 4 years. Before the test, Aizack seemed to be very anxious. But after a few minutes of waiting, he was able to get his results.
Die Messung ist beendet, das Gerät wird automatisch gespült und ich kann hier die CD4-Zellzahl ablesen. Wir haben also eine CD4-Zellkonzentration von 409 Zellen pro Mikroliter, was einen guten Wert darstellt.
109.
Yeah.
Asante.
Yeah. Good.
Asante sana.
Yeah.
Asante sana. Ndio. I'm very happy.
Me too, Aizack.
Yeah.
I'm very happy
Because
Yeah.
they didn't do since 4 years now.
I have,
Yeah, good.
I think 4 years and some months.
Ah.
Because since 2005,
No
I think I
analysis.
forgot. Yes.
Yeah, I think it's a good value. It's a value within the range. 490.
It's very much okay.
Thank you very much. Thank you. I'm very happy. Thank you, doctor. Thank you very much.
You're
I'm
welcome.
very happy now.
Yeah. Yeah.
If I can go home, can talk for everybody, for our friend, for member of Puma, to say this machine is good. Though also we are fighting to say that machine is not good. Our first machine was good because every member of Puma, he knows about these things.
After years of waiting, Aizack gains assurance about his state of health. His CD4 count isn't high, but still within an acceptable range. The HIV patient finally gets a current CD4 count written into his patient card. On a walk through the conference venue, Aizack discovers a wish tree. Many people from all over the world had already written their wishes on slips of paper and hung them on the tree. Aizack knows exactly what he will wish for: a properly working CD4 counter for all HIV patients in Tanzania.
The idea is that patients are treated where they live. But then, if you have this system, which is actually desirable, you need very simplified tools to help those healthcare workers to deal with the patients. The most easy tool would be just something like a pregnancy test, where you could use not venous blood, but just prick the finger, use a drop of blood, and put it on a slide or on this application, and then you would have a CD4 result. This would be the ideal simplified tool.
However, until such rapid tests come onto the market, the most dependable and cost-effective CD4 counters must be used. Otherwise, people's lives are at risk.